is telling you that how the test I have explained above have can indicate what kind of emergency situation or what kind of situation a patient is. If he is in stage 1, he can be called acute renal function disorder. If he is or she is in chronic setting, then it can be called stage 3 or stage 4 problem. And if treatment is already going on, then there can be anything. So all these indications just help the doctor to give proper treatment therapy and safe and effective use of drugs. Next up is clinical significance. Clinical significance are of can be of creatinine and blood urea nitrogen. We already know about serum creatinine and blood urea nitrogen test. So serum creatinine levels are elevated when glomerular filtration rate, that is GFR, significantly reduces, or when urine elimination is obstructed. About 50% of kidney function must be lost before a rise in serum creatinine can be detected. Thus, serum creatinine is a late marker of acute kidney injury. This limitation is why other substances that may be elevated earlier in the disease process are being studied as markers for kidney disease. So, serum creatinine is a late marker for acute kidney injury. When 50% of kidney function is lost, then only serum creatinine is increased. Blood urea nitrogen or serum urea levels increase in acute and chronic renal disease. Equations for eGFR are used to determine the presence of renal disease and the stage of CKD and to monitor response to treatment. CKD, we already know, is chronic kidney disease. eGFR is estimated glomerular filtration rate. BUN is blood urea nitrogen. So, serum urea can be used to detect acute and or chronic renal disease, and also to monitor the response of the treatment of CKD. Next slide is patient safety and education. For GFR measurement using radioactive isotopes, patients should be advised regarding the small amount of ionizing radiation involved and the need to exclude pregnancy in any female of childbearing age before the test. In general, patients undergoing blood draws should be advised regarding potential issues of bruising and pain. 24-hour urine collection bottles may contain small amounts of preservatives such as thymol, and direct contact with skin and mucous membrane must be avoided. Collection bottles must be kept out of reach of small children who may accidentally ingest the preservative contained inside. Patients should always be advised to maintain regular fluid intake before these tests. So these tests have some precautions, and patient safety and education is one of the most important part in our field. So for anyone who is going for GFR, we need to exclude firstly the women of childbearing age before this test. And for general patient, the blood drawn should be advised regarding potential issues of browsing and pain. That means any person, if they draw blood, then they are advised to look about the bruising and pain of on it. Then there. Then 24-hour urine collection bottles may contain small amount of preservatives, so like thymol. So direct contact with skin and mucous membrane must be avoided. They are saying The urine collection bottle contain thymine, and they need to be not come in direct contact of skin and mucous membrane, so that there may not be any uh, problems. That this is a precaution that is need to be taken. And this is also important for small children who can accidentally ingest those preservatives. Also, they need to maintain regular fluid intake. Patients should maintain all these things before going for any test related to kidney function. Complications of the majority of tests of renal function are rare. Apart from those related to venipuncture, measurement of GFR using isotopes may cause minimal radiation exposure. However, it is not advised to have repeated exposures over short periods. Some patients may experience allergic reaction to radio contrast agent containing iodine. So there are not many complications. It is mostly a safe test. Normal and critical findings. The normal GFR for adult is 90 to 125 ml per minute in individual older than 2. So this is the range for anybody older than 2. 90 to 125 ml per minute. A GFR of less than 15 ml per minute is considered to be end stage renal failure requiring renal replacement therapy. A normal GFR does not exclude renal disease, which may be evidenced by albuminuria, proteinuria, or imaging studies. Reference intervals for serum creatinine and urea are dependent on age and gender. The presence of electrolytes in urine depends on the hydration status and duration of the urine collection. Apart from pathological factors, reference intervals are often wide and dependent on clinical context. Here, basically, they are telling about in the serum creatinine and urea, the reference intervals are always related to age and gender. That is, basically, they are different for female and males, and for adults, children, and older people. The presence of electrolytes in urine, this also depends upon the hydration status and duration of urine collection and other pathological factors. In this also, reference intervals are often wide and dependent on clinical context. So this was about this slide was all about patient safety, the complications involved in these tests, and all the critical findings that we will see in the report. The next slide is not here. That was that was the last part. And to give a basic conclusion to this is that when you go for any kidney function test treatment, then you can include any blood report or anything that can be that can be used as a reference to see whether you have any disorders in kidney or not. Thanking you. This was all of my presentation. Meet you next time.